Hosting this event for our friends at Nanostics and of course the Alberta Cancer Foundation. But before we start, I'd like to start by acknowledging that we are hosting this event on Treaty 6 territory. The entire Edmonton region is located in Treaty 6, a traditional meeting grounds, gathering place, and traveling route for the Cree, Saulteaux, Blackfoot, Métis, Dene, and Nakota Sioux. We are honored by the long history of Indigenous peoples that have resided here for centuries. Enoch Nation, and I got this fun fact from Chief Billy recently, Enoch Nation is located in the Edmonton region that actually has a very unique connection to the life science sector that many of you may not know. The Cree name for Enoch is Muskegossi, which translates as people of the land of medicine, which is really an interesting and fun fact and one to put in your pocket for the next time you do a land acknowledgement. And as we gather here today, we celebrate this exciting announcement. We also recognize that it's National Day for Truth and Reconciliation, which will be coming up on the weekend. And it's also a time to reflect on the long history of Indigenous traditions around health and medicine that has taken place in our region. It's been a wonderful week of celebrating the health and life science sector here in the Edmonton region. A huge congratulations and thank you to the Applied Pharmaceutical Innovation, API, for spearheading the Life Sciences Week celebration. Do we have API here in presence? Well done, thanks very much, API. From the networking events to announcements to tours, there's been a lot happening. It's been great to see the excitement within the life science sector, but also one that's showing a growing awareness of what the health and life science sector does, both in terms of actual community good, but also an economic impact, and that this sector in particular will have on this region. So depending on who you speak to, but almost 70% of all the health life science companies in Alberta are here in this region. And that's hugely significant when you look at what that does in terms of economic impact. At least $1 billion in revenue, employ more than 12,000 people in this sector. And if we look at this announcement today, the total global accessible market for this net new diagnostic tool alone is projected to be at $5 billion annually. An incredible achievement. Congratulations. We know that there is strength in this sector here, and that's why we're excited to host this exciting announcement. Congratulations to the whole Nanostics team. And now I'd like to hand it over to the MC, because I'm not, to my friend, Rich Joseph. Rich, over to you.
This down about 2.5 feet. Thank you everyone for being here this afternoon. We really want to thank Edmonton Global for hosting us this afternoon. Malcolm, you and your team have embraced life sciences. Thank you very much for all that you and your team do. You've been championing the strengths of the life sciences sector to the globe and bringing talent and investment right into our region, and you've been doing a heck of a job. So thanks very much for that. The first speaker is from the government of Alberta. We have MLA Justin Wright from the riding of Cypress Medicine Hat.
Well, thank you, everyone. I really appreciate the opportunity to be here. When I found out from Minister Klubish's office about an hour ago he wasn't going to be able to make it, it was a great opportunity to learn about such a fantastic made in Alberta solution to health services or health sciences. Sorry. As mentioned, my name is Justin Wright. I'm the MLA for the charming constituency of Cypress Medicine Hat, and I'm honored to be here today to bring greetings and congratulations on behalf of the government of Alberta for this exciting announcement in life science industries. Supporting a strong health technology and innovation industry in Alberta benefits us all. The more technology advances us, we become more healthy. The better prepared we are for facing the challenges that come along the road ahead. I'm so proud to join you today for this Made in Alberta solution, this Made in Alberta story that revolutionizes the healthcare industry. Nanostics is a precision health diagnostic company founded here in Alberta in 2017. It's changing the face of healthcare in Alberta and beyond with state-of-the-art product design and bringing clarity and more accuracy in diagnosing the devastating prostate disease. Nanostics is developing a machine learning diagnostic tool called ClarityDX Prostate. that can calculate the risk of developing aggressive prostate cancer and help determine whether we need a biopsy. As we all know, biopsies are invasive, painful, and often come with a whole slew of side effects. This is a game changer because it gives men facing prostate cancer access to the best tools to help manage the disease. Prostate cancer is the second most common form of cancer among men here in Canada, and is the third leading cause of cancer-related deaths. In Canada alone, it is estimated 25,000 men will be diagnosed with prostate cancer, and 4,600 will die from that disease every year. ClarityDX Prostate is a breakthrough innovation we need to help prolong the life of Albertans. It's incorporating into the standard care, it will be incorporated into the standard care in Alberta with the collaboration of DynaLife Medical Labs. This has far-reaching implications and benefits for Albertans facing cancer treatment. As we all know, cancer treatment can be quite expensive, and patients may incur some out-of-pocket expenses. And the last thing we want here in Alberta is out-of-pocket expenses be prohibiting the lifespan of our citizens. The Alberta government is proud to see that Nanostics collaborated with the prostate researchers at the University of Calgary and Alberta to integrate analytical power of artificial intelligence into the solutions of tackling this disease. This speaks to our very promising, innovative life sciences ecosystem. I want to take the opportunity here to acknowledge Alberta Innovates for their early investment in Nanostics through the Alberta Small Business Innovation and Research Initiative, which helps commercialize Alberta-owned innovations in cancer detection. Thank you to AHS and the Alberta Cancer Foundation for making this possible. Alberta's government is committed to investment that allows Alberta-based companies to test their innovations in real-world applications, accelerate innovations, and bring them to the marketplace. And I'm encouraged to see this as the next step forward. When we take a look at Nanostics taking the next step forward, I understand that they are taking this test internationally, which puts Alberta on the global map for health services. And your work is putting Alberta to the forefront in digital health technology and making our ecosystem flourish. And this is what will ultimately help Alberta's position as a leader in research and development. Thank you for your time.
Thank you very much, Emily Wright. Pleasure to have you here today. My next speaker is, I'm pleased to bring greetings from the city, our councillor, Tim Cartmel, who is my councillor, and no stranger to the innovation system here in this region. Tim, come on up, please.
Thanks, Rich, and it's a pleasure to be your councillor, although, you know, those sort of possessive kind of comments, I'm not so let's just be clear. I'm not really possessed by that's so many different things, isn't it? It is absolutely my pleasure to be here on behalf of Edmonton City Council and Mayor Sohi here on Treaty 6 territory. And I want to say I really wanted to be part of this announcement. We heard some of the statistics about prostate cancer in Canada. One I want to add is that 1 in 8 Canadian men are expected to be diagnosed with prostate cancer in their lifetime. And if not caught, just 3 in 10 are expected to survive within 5 years. So those are pretty daunting statistics. Last June 28th, I was diagnosed with prostate cancer. And in January of this year, January 12th, I had prostate surgery. Now, I'm not trying to make this about me, but I just want to, through this example, demonstrate just how important this is. I had a fantastic general practitioner, GP, who knew my family's history and very carefully monitored PSA scores for me. In about 3 years, they jumped. So I was referred to a urologist and was monitored, and it stabilized. And then about a year after that, it jumped. And so I had an MRI, and the MRI came back and said, 85% negative, you don't have cancer. And then 6 months later, it jumped. And so I talked to my urologist, and he says, it's probably nothing, it's probably negative, but we'll do a biopsy just in case. And so we did a biopsy, and I had cancer. And I don't really know how to say that, if I have cancer or I had cancer, because the prostate's gone, so maybe I can't, that kind of a thing, right? But how do you really say that? In any event, I had the surgery in January. Now, my understanding of what Nanostics has done here is create a product or create a test or create a system. And I don't know all the ins and outs. I confess I get to touch on this innovation meets life sciences thing here periodically and as much as I can through the city. But as I understand it, this is going to really help understand more clearly, without a biopsy, whether you might have prostate cancer or not. And Malcolm just suggested a slide there. I don't know if you saw the graphic that popped up, but the savings that might be gained by avoiding those biopsies and by avoiding the cost that comes to the medical system or the healthcare system are phenomenal. And not only is that money saved, but that's money that can be directed to other things, other services, other things that we need to pay for. So that is really cool. But for somebody in my position, when you kind of think it's negative, but you're not quite sure, and you're not, should I do a biopsy or not? Should I wait this out? What should I do? Because biopsies come with, with those particular risks. Having something like this that says, you know what, you are at a heightened level, you do probably have cancer, and we're going to do a biopsy as much to figure out what your treatment is, which of course the treatment's going to be, rather than trying to use it as a diagnostic tool. It changes it. So this is really important, and I can tell you that it's weird when you find yourself in different cohorts. When I first opened my business, it was like a curtain was pulled back, and I met all these people that own their own company, that you never knew. This is the same thing. The number of people that I've encountered in the last year that have had prostate cancer, have had prostate surgery, have gone through that same journey of making decisions and trying to understand the implications of the decisions, and have brought their life partner or their family with them. There's a lot of us. There's an absolute ton of us. So I really want to thank Nanostics and whoever else is involved, Alberta Innovates, API, Life Sciences, cohort in Edmonton, the life sciences market industry cohort, however you want to state that. And I said this earlier this week, kind of flies under the radar in Edmonton. There is amazing things being done here, right here. There's amazing things happening here that offer employment and opportunity here. We have 8 fantastic post-secondaries in Edmonton. And we have a regulatory regime that allows this kind of R&D stuff to happen in Edmonton. We are perfectly positioned for this kind of stuff. We need to tell that story more. We need to publicize that more, and we need to bring more people here to do this kind of stuff here, to keep our people here, to employ people here, to have this kind of thing happen here. So I will just leave on that. I will remind you that September is Prostate Cancer Awareness Month, but there's only about a day left in that. So come November, check on my social media, because I want your dough, because we need to do a lot more of this. Thank you very much. It's a pleasure.
Thank you very much, Councillor Cartmel. So in my notes, there's a note that says I need to talk about the magnitude of this announcement today. So here we go. I don't want to steal the thunder from the speakers that are coming after me, because they're the ones that can actually talk about this. And so I'm not going to talk to you about prostate cancer. I'm going to very quickly mention a challenge that we have in Canada, which is to discover something in the lab and get it to the clinic and impact patients is actually really challenging to do in Canada. So I want to just impart on you the challenge that is, and that we've actually accomplished it here. And it's a team effort. It's the Nanostics team, it's the research team at the U of A, it's Alberta Innovates, it's the Cancer Foundation, it's Alberta Health Services, and the list goes on and on and on. We'd be here for a long time for me to mention everybody that has a hand in bringing this test to us, which is wonderful. So our next speaker really doesn't need an introduction into this room. He is a scientist extraordinaire, serial entrepreneur, and he is the founder, CEO, chairman of the board of Nanostics. John Lewis.
I wasn't sure if I would get up here and scream or cry or both of those, but I'm going to actually say a few words about the story that brought us here. What an incredibly exciting day today. As I look around the room, I see so many faces of people, like was mentioned, have supported us, have participated in the research, have donated their blood to help us get to where we are today. So first of all, thank you so much, Malcolm, for hosting us here. Edmonton Global has played such a huge role in the ecosystem in the city, promoting what we're doing here. Just thanks so much for all your efforts. Thanks so much, Reg, for that kind introduction and really framing sort of the challenges around wanting to make an impact on patients, but how much effort and time and resources and support it takes to get to where we are today. Thanks so much for opening words, Justin Wright and Tim Cartmell. You actually really perfectly framed the challenge and the personal story and the challenge that all men have and all people have when they're faced with the diagnosis of a very scary disease. So I'm not going to talk about sort of what the test is yet. I want to take you a little bit through the story and the contribution of everybody to the success today. So it's been a really long journey, about 12 years since we had the first concept of developing a novel way for men to get screened for prostate cancer and to get more clarity about whether their prostate cancer can benefit from treatment and whether that treatment will save their life. And so I was recruited to Edmonton in 2011 as the inaugural Frank and Carlos Adjunki Chair in Prostate Cancer. And I got a chance to meet Frank, who unfortunately later passed away from prostate cancer. But I got to know him and his wife really well. And for those who didn't know Frank, he was certainly a dynamic, perhaps controversial individual. And he was a very successful Edmontonian who was diagnosed with prostate cancer some 23 years before I met him, and had benefited from a lot of different amazing innovations in both diagnosis and treatment. And had spent some time in Vancouver where they have a fantastic world-renowned prostate cancer program. And he asked his medical oncologist, what are we doing here in Edmonton for cancer research, prostate cancer research? And Peter Venner, his oncologist, basically said, well, not really anything. And so he put together a bunch of his friends, many of whom are here in attendance. They called themselves the Bird Dogs, and they went out and what I really admired about them, in fact, I got a chance to meet them when I first visited Edmonton, interviewing for the position, and what really touched me about them is that, certainly Frank was a galvanizing individual, but they were really getting out there and hitting the streets, drumming up interest for prostate cancer and awareness, and were able to put together the funds to really kickstart this chair position. So his vision was really not only to help himself and obviously deal with his disease, but really bring translational research to Edmonton. And translational research, for those of you who don't know, is really doing academic research, which is really discovery driven, but with a line of sight to the patient, about making an impact in a specific patient. And when you do that, the kinds of experiments you do gives you a focus that allows you, ideally, to move to that final impact much more quickly. And so, with dedicated philanthropists like Frank leading the Bird Dogs, teaming up with the Alberta Cancer Foundation, who've been partners since the very beginning, their initial funding kickstarted our program, further funding for the Motorcycle Ride for Dad, University Hospital Foundation, provincial and federal agencies, Alberta Innovates, NRC IRAP, the list goes on and on. Really key partners like the University of Alberta all helped us to create an amazing research team. And we called this team the Alberta Prostate Cancer Research Initiative. And it was really a group of over 100 scientists, physicians, nurses, clinical trial folks, patients, survivors, all focused on this idea of making an impact on the way we diagnose and treat prostate cancer. So APCARI grew over 10 years to a province-wide research initiative, partnered with the Prostate Cancer Center in Calgary and the Kidney Urology Clinic in Edmonton, and dedicated as a group to improving prostate cancer care in the province. And so what we did, and thinking forward, so our goal was to create better ways to diagnose prostate cancer and inform whether to treat. And we looked around the world at patient groups to be able to validate our test and realized they just didn't exist. So we actually created the APCARI biorepository, recruiting over 15,000 men in Alberta, collecting all their information, their blood, their urine, thousands of samples that went into a state-of-the-art biobank, the world's largest liquid biobank for prostate cancer here in Edmonton. And not only did we use that to develop this test, we made it available to researchers all around the world to validate similar innovations. We're super proud of that. Now that for us led to an initial discovery in 2017 of a novel test of biomarkers that did a great job of distinguishing whether a man, number one, had prostate cancer, importantly, but number two, whether it was aggressive. So whether it was the kind of prostate cancer that was likely to benefit from treatment and that would justify the invasive biopsy and of course the very invasive treatments that are life-saving. So this eventually evolved into the test we're announcing today, ClarityDX Prostate. So since 2017, we've been kind of busy. So 2017, we launched Nanostics, a spin out from the University of Alberta. We talked to the FDA and Health Canada. We completed a really ambitious international multi-site study consisting of 3,500 men. We recruited from major centers, including Johns Hopkins University, UCLA, and of course all of the centers in Alberta, specifically from Kipnis Urology Clinic and Prostate Cancer Center in Calgary. And I have to say, and I'm very excited about this, the results were fantastic. And so we found out through this study that ClarityDX Prostate was 3 times more specific for aggressive prostate cancer than the PSA test alone. That is huge, 300%. Which means that if we do ClarityDX Prostate on a population of men who have elevated PSAs, we can get much more certainty about whether they have aggressive prostate cancer that needs to be treated. And so the current standard of care recommends that men 50 years of age or older get PSA tests done, and we're going to stay with that standard of care. If they have a PSA lower than 3, then they're going to wait until next year for another test. But if they have an elevated PSA, they should get our test. And so, and the reason for that is because the challenge of PSA testing, it's been controversial. PSA is not a very specific test. 85% of men who have an elevated PSA do not have prostate cancer. And so PSA screening has resulted in the detection of many aggressive prostate cancers, but also a large number of non-aggressive or non-existent cancers. And so that's resulted in a lot of unnecessary biopsies and a lot of unnecessary surgeries, resulting in sort of a lifetime of morbidity when it wasn't necessary. So as a result, task forces and the one in Alberta recommended against PSA screening, which was really painful actually for a lot of researchers and clinicians, because the mortality rates actually have increased since then, because we haven't been detecting as many aggressive prostate cancers. So that's why I'm particularly excited to announce the success of our test, because we get to bring PSA screening back to what it should be, much more accurate and much more beneficial for men. So if we adopt ClarityDX Prostate into the standard of care, and that test, I'm happy to say, is available today, it means that we can potentially avoid up to 35% of unnecessary biopsies. That is a huge number. So as was mentioned, it represents huge savings to the healthcare system through not having to do those biopsies, not having to do those surgeries, and that money can be redirected, as you said, toward curative treatments and state-of-the-art treatments. So super excited about that as well. As far as implementing the test, we've had a fantastic partnership with Dynalife. And I have to mention Jason Pincock has been just a friend and an ally throughout the process. We created the Nanostics Clinical Lab in Edmonton, which was recently accredited by the College of Physicians and Surgeons of Alberta, or CPSA. So now we're ready to provide the ClarityDX Prostate test to men all through Alberta. And I'll just finish up by saying, obviously as a company, a profit-driven company, our biggest market is the US and other places. It's definitely not Alberta. All of the team felt very strongly, me in particular, we've had incredible support from our community, from funders, from patients, from survivors throughout Alberta. It was really critical for us to launch our test in Alberta first, and that's what we're doing. Which brings us to today and our exciting announcement. ClarityDX Prostate test is available now to all men in Alberta. Thank you so much for listening.
Dr. Lewis, thank you very much for that. Thank you for you and your team's ingenuity and, more importantly, your tenacity. So you'll be hard-pressed to find a successful startup company in the tech sector that hasn't somehow been touched by Alberta Innovates. It gives me great pleasure to introduce the CEO of Alberta Innovates and my mentor, Laura Kilpies, come on up.
Everyone is definitely taller than me. Reg, thank you very much. Those very kind words. Given this event is such a great way to continue the amazing news associated with this Life Science Week happening here in Alberta, I want to congratulate all those people who are making Life Science Week possible. You know, Alberta Innovates is deeply committed to making a difference in healthcare for Albertans, and our strong focus on digital health strategy is so important, led by some of my colleagues, and I do want to recognize them. Tim Murphy, Sunil, who else is here? I'm not sure. By the way, guys, take note of them. They've got the money, not me. But really, MLA Wright and Councilman Tim Goodwill, again, great announcement. Dr. Lewis, what can I say to you other than fantastic piece of work? We're so incredibly proud of you, and we're just so happy that we've been able to support you and your team. We know none of us does this alone. In fact, I too don't do it alone, not just with my team members, but our partners. And our partners like Malcolm Bruce and Global Edmonton, I cannot thank you enough for the work that you've done with us as well. You know, hosting this celebration is minor compared with the work that Malcolm and his team at Global Edmonton do behind the scenes to make many things possible, so thank you, Malcolm. You know, normally I would say it's a pleasure to be here, and of course it really is, but we are here because of this urgent need. Prostate cancer can be a deadly diagnosis, as you've been told. It's the third leading cause of cancer-related deaths in Canada, and you've heard from others, about 25,000 men are diagnosed a year, and about 20% of those sadly die. The cost to our healthcare system is great, but in my personal opinion, the loss of one life and one guy, as I would say, is an infinite cost to all of us. And so we have to make sure everyone's healthy. And as our population ages, we know that the need for screening and treatment will increase. I believe the only way that we can make better treatments for our patients is to improve our systems of care and manage costs through innovation. Innovation is, in the health and life sciences sector, required when we can meet three conditions. You know, first, a strong support for basic and applied research through productive knowledge networks. So please, we must not forget our universities, we must not forget our research institutions, because that's often where this kind of work starts, as was evidenced by Dr. Lewis's comments. And we're very fortunate to have a team at Alberta Innovates who funds much of that research through all of our universities here in the province. And in fact, I think, Dr. Lewis, after you came here, it wasn't too long after, in 2013, which we first gave a grant for this research. The second condition is developing a thriving and competitive market. I hate to say this, folks, but I'm all about making return on investment. And so as we have to make sure we understand where that competitive market is, so players like Dr. Lewis and Nanostics can actually withstand the financial risk and make long-term commitments. And not just to us in Alberta, but to the patients that they will be serving through their product. And through Alberta Innovates, we of course support many other things, such as the ACE Concepts program, R&D, all kinds of things that help these companies as they go along. You know, the Nanostics story is a great reminder of how necessary long-term investments are to move from the lab to market, and especially so in the life science area. Dr. Lewis, you may have thought this has taken a long time. From my experience in this marketplace, you've moved at light speeds with life science. And you should be congratulated that, because we all expect our successes to be overnight successes. But it's those, as Reg said, who are persistent and tenacious and are really driven by their mission that really make the great successes for us. The third condition we need for success is the health and life sciences sector have inspired leadership based on mutual confidence and open dialogue. And that inspired leadership comes from all of you here. So please, this is no act by one person or one group of people, whomever their label may be or their title may be. It's about all of us together. And we've clearly seen the Nanostics team have provided such inspired leadership that they have truly made a difference in Alberta's life science sector, not just by contributing it, by becoming what I dare say will be a powerhouse like you haven't seen here for a very long time. You know, it's part of diversity in our economy, and this is why companies like Nanostics are so important to this ecosystem in our province. You know, I could go on, and I've got lots of other things here to talk about, but I think what's more important is to say, when we work together, no one can beat us in Alberta. When we work apart, we really don't go too far. So let's work together and find more Dr. Lewis's, more Nanostics, and let's all support them. Because I'll leave you with one last example. That last example is one technology that did come from Canada and escaped Toronto, actually, to Denmark. And it was in the field of diabetes. And today, that company that took that Canadian technology is the largest diabetes company in the world. And last week, that one company in Denmark had a market cap of $461 billion, greater than the whole GDP of the country in which it resides. So, Dr. Lewis, just a small challenge for you. Because we know this is not only going to be meaningful to all the men in our lives, it's going to be meaningful to Edmonton and Alberta, and we're so incredibly proud of you and what you're doing. Thank you for the
Thank you very much, Laura, for those words. So if you mention innovation and philanthropy in the same sentence, there's one name that rises up that embodies that. And that name is Christy Holtby. I'd like to introduce Christy Holtby, who is Vice President of Philanthropy at the Alberta Cancer Foundation.
And to think I was nervous about what you were going to say, Reg. That was so lovely. Laura, at the Alberta Cancer Foundation, we also believe in return on investment, and for us, that's more moments for Albertans facing cancer. First to John and the entire Nanostics team, what an incredible day. From an idea to the bench to this moment, when you can walk into a lab in Alberta and ask for the ClarityDX prostate test, and the answer will be yes. To the Albertans who participated in the research, the clinical trials, they donated their dollars, they raised dollars, and they advocated for this. And Bob, I hope you, in particular, that you own your piece of this and take great pride in today's investment in the efforts of looking around the room to the patients, the survivors, the donors, those of you who are all three, your smiles say it all. You made this possible. This is also a moment to celebrate collaboration and partnership. In this instance, a public-private philanthropic partnership. How could we get a made in Alberta product to market, to the patient? In 2018, Alberta Innovates, Dynalife, and the Alberta Cancer Foundation launched a program to tackle this, the Aspiri grants. Nanostics was the very first recipient announced in that challenge. To me, the amazing part is, we went from a group of people who cared, coming together in 2018, lived through a health pandemic, and have emerged only a short time later with a non-invasive test that will change the way men face prostate cancer. It's a testament to Alberta, the strength of our province, and our partnerships. And today we see that paying off in spades. 1 in 2 Albertans will face a cancer diagnosis in their lifetime. And isn't it remarkable to know that the best researchers, the best solutions, and the best care are happening right here at the Cross Cancer Institute, at the Arthur J. E. Child Comprehensive Cancer Center, and the community and regional centers across our province. You don't have to leave Alberta to have exceptional outcomes. It's happening in our own backyard. And apparently I'm getting emotional. This is the 3rd time John and I have done this today. This speaks to this is a testament to the life sciences ecosystem in Alberta. The team at the Alberta Cancer Foundation gets up every day thinking about our mission to create more moments for Albertans with cancer. And we share that mission with Dr. Lewis and the Nanostics team. And with today's announcements and the launch of ClarityDX Prostate, we have done just that. It's incredible to see what can happen when Albertans come together to support big ideas. Congratulations to everyone.
Thank you very much, Chrissy. So that brings us to the close of this wonderful celebration. We have all the speakers will stay around. If you'd like to chat with them, please do. I understand we might even have a couple of patients with us as well. Terry Velasco, John Sexsmith, so please reach out to them and have a chat with them. But John and the team at Nanostics want to personally congratulate you for myself, for my team at Health Cities, and of course, all of us here. Congratulations, Nanostics.